Hi, I'm Art Caplan. I'm the director of the Division of Medical Ethics at the NYU Grossman School of Medicine in New York City. Well, New York City is out on the cutting edge of a very controversial program. It has two centers operating as overdose prevention centers, OPCs, where individuals can come who are using drugs and take, say, heroin or other drugs under the supervision of a healthcare professional or trained person. One is up in Washington Heights in Manhattan. The other, I believe, is over in Harlem. And these two centers will supervise people taking drugs, and they have available all the anti-overdose medications, Narcan and so on. If you overdose on the spot, they will help you and try to counsel you to get off drugs, but they don't insist that you do so. You can go there time and again, even if you're an addict, and continue to take drugs under supervision. So this is called a risk reduction strategy. Some people note that there are over 100 centers like this worldwide. They're in Canada, they're in Switzerland, many other countries, and they seem to work. Working here means more people seem to come off drugs slowly, not huge numbers, but some, than if you don't do something like this. And death rates from overdose go way down. By the way, having these centers in place has other benefits. They save money because when someone overdoses out in the community, you don't have to pay all the costs of ambulances and people rush to emergency rooms and all of this sort of situation, even risk to the first responders that might be out there due to fentanyl or other things. Less syringes littering around in parks and public places where people shoot up. You have everything controlled when they come into a center, so that's less burden on the community. And it turns out that you have less crime because people just aren't out there harming other people or robbing other people to get money, to get the next fix. The drugs are provided for them. And so crime rates in the neighborhoods around the world where these centers operate seem to dip. So there's a lot of positive. There's also some negative. People say, shouldn't be the job of the state to keep people addicted. It's just not the right role. Everything should be aimed at getting people off drugs, maybe criminal penalties, if that's what it takes to get them to stop using. But I have to say my own view is that that hasn't worked. Tough prison sentences, trying to fight the war on drugs just doesn't seem to work. We had 100,000 deaths last year from overdoses from drugs. That number's been climbing. We all know that we've got a terrible epidemic of death due to a drug overdose. It seems to me these centers that are involved in risk reduction are a better option for now until we figure out some way to come up with interventions that can cut the desire, the drive to use drugs, or really are antidotes that are effective, if you will, for months or years to prevent people from getting high, no matter what drugs they take. So I'm going to come out and say, I think the New York experiment has worked. I think it has saved upwards of 600 lives, they estimate, in the past year. That would have been overdoses. I think cost-wise, it's effective. I think related damages and injuries from syringes being scattered around and robbery and so forth, all to the good. Even a few people coming off drugs due to counseling, which is a better outcome than we get when they're just out in the streets. So I think other cities want to try this. I know Philadelphia does. I know New York wants to expand its program. The federal government isn't sure, but I think the time has come to try an expansion. I think we've got something that, while far from perfect, and I wish we had other tools, this may be the best we've got. And in the war on drugs, little victories ought to be reinforced. I'm Art Caplan at the Division of Medical Ethics at the NYU Grossman School of Medicine. Thank you very much for watching.